Hi, today I will be talking to you about the local complications of local anesthesia and its management. So let's start. First is transition nerve paralysis, a transition facial nerve paralysis, which is caused by the introduction of the local anesthetic into the capsule of the parotid gland, which is located at the posterior border of the mandibular ramus, and it is clogged by the medial pterygoid and the masseter muscles. Facial nerve paralysis is also caused during inadvertently directing the needle in the posteriorly during inferior alveolar nerve block, or deflecting the needle posteriorly, or over insertion during Vazirani Akinosi nerve block. Now, what do you see? So, there is a unilateral facial nerve paralysis is seen, and there is a loss of the motor functions of the facial muscles. So, the patient loses all the facial expressions on the affected side, but rarely there is a loss of the sensory functions of the facial muscles. So, what are the symptoms, or what is the loss which you see? The patient is unable to close the eyelid. Then there is a loss of the winking and the blinking of the eye. Then the patient is unable to elevate the lip on the affected side. The patient is unable to raise the muscles of the forehead. Then corneal reflex is intact, but tears lubricate from the eye. What about its management? So you have to reassure the patient that this problem is transient, and it was usually last about 3 to 4 hours. Very rarely the problem lasts for not more than 3 weeks. So during the time period, the patient is asked not to wear the contact lenses, and eye patch is given to the patient. Next important complication which we come across is hematoma. Hematoma is the effusion of the blood into the extravascular spaces, which is caused by the nicking of the blood vessels. And hematoma rarely produces significant problems aside from resulting a bruise which may or may not be visible extraorally. Possible complications of the hematoma include trismus and the pain. What is trismus? Now, what about the hematoma? So the bruise which is seen, you have to reassure the patient that this problem will last not more than 7 to 14 days, and the bruise will subside. Next important complication is trismus. So trismus is a kind of a prolonged tetanic spasm of the jaw muscles, in which a normal opening of the jaw is restricted. So trauma to the muscles or the blood vessels in the infratemporal fossa is the most important etiologic factor which causes the trismus. Now, hemorrhage is another cause of trismus. Large volumes of the extracellular blood can produce tissue irritation leading to the muscle dysfunction. So, you should use always aseptic technique, and contaminated needles should be avoided. And also the over insertion, like the patient, you don't know the proper anatomy during the inferior alveolar nerve block, and you are inserting needle again and again, so this also causes trismus. Now coming about the management of the trismus. So management of the trismus includes in that case muscle relaxants like diazepam, 10 mg or benzodiazepines are given to the patients. Then warm water gargles or warm water fomentations should be given to the patients. Warm saline gargles are also advised to the patient, so that the jaw muscles which are restricted, so they get relaxed. Next important thing which you can prescribe to the patient is a physiotherapy should be given to the patient. And then in case of lot of pain, analgesics like diclofenac should be given to the patients. Patient should be advised to chew the bubble gums. So while chewing the bubble gums, the muscles which are contracted or spasmatic, they will get relaxed. Next important complication which we come across is edema. Edema is caused because of the trauma during the injection. Hemorrhage is kind of the effusion of the blood into the effusion of the blood into the soft tissues, which produces swelling. Next is needle breakage. So in cases of the needle breakage, this problem is avoided that you should never use the bent needles. So you should see that the hub of the needle is proper. Like, in the cases of needle breakage, litigation matter can also happen with the physician. So coming about say the management of the needle breakages. So first of all, you have to calm the patient that this problem occurs. So there is nothing to worry about it. If the needle is seen, if the tip of the needle is seen uh, inside the mouth, so in with the help of the hemostat, uh, it should be the needle should be removed. And in case if the tip of the needle is not seen intraorally, the radiographs are taken to locate the proper location of the needle. In case of you are not able to locate the needle, so oral surgeon should be called for the help. In certain cases, in cases with lot of the complications, the patient should be advised to leave the broken part there only. However, litigation matter can also occur with the physician. Burning on the injections can burning on the injections, or there is a development of intraoral lesion after the local anesthetics can also occur. So all these problems, they subside after the course of the antibiotic and analgesics. That's all about the local complications. Thank you. Bye.